Diverticular disease is really a spectrum of two diseases. There's diverticulosis, and osis just means you have diverticulum. And diverticulum are little bubbles, kind of like bubbles on a bicycle tires. They're pockets on a colon. Diverticulitis, on the other hand, is an infection. Itis is the doctor's word for infection. Appendicitis, bronchitis, tonsillitis, diverticulitis. That means that there's an active infection in your colon. Diverticulosis, again, or the presence of the diverticulum, is asymptomatic. Patients have no symptoms from diverticulosis. Diverticulitis is an active infection of the colon, and the symptoms can be very severe. It's significant pain, and it's pain usually in the left-sided, right in your left lower quadrant. Fever, and if you happen to get to a doctor, he may draw a blood test, and you'll see an elevated white blood cell count. Again, all markers of an active infection. Diverticulosis, although we're not really sure, we think is caused by a low-fiber diet. The idea is the colon is like a toothpaste tube, and that when you squeeze it really hard, there are natural weak points in it. To get that extra bit of toothpaste out, you put extra tension on the wall of the colon, making these little pockets form. Diverticulitis, on the other hand, that active infection, is due to a microscopic perforation in the colon. The mainstay of treatment for diverticulitis is antibiotics. Often your physician will give you antibiotics, and there's usually a combination that we have you take to minimize that infection. There's a rare group that does need surgery, and those patients are people who have multiple attacks of diverticulitis, who have some of the consequences of complications such as a stricture or narrowing of the colon, causing a bowel obstruction, needing emergent surgery, or people who don't have a microscopic perforation, but actually develop a big hole in their colon necessitating emergent surgery. Otherwise, antibiotics really will take care of most cases of diverticulitis. The dietary management of diverticulosis is relatively straightforward. You'll hear all kinds of tales about no seeds, no nuts. Unfortunately, there's no proof for that. What we do know is that to limit the sequelae of diverticulosis, possibly turning into diverticulitis, you need to eat more of the right things: more fruits, more vegetables, more fiber, and drink more water. If you're unfortunate enough to have an attack of diverticulitis, at that point your diet needs to change. And contrary to what we just said, you need to go to a low fiber or low residue diet until the inflammation or infection resolves. Colon and rectal surgeons are experts in the surgical and non-surgical treatment of diseases of the colon, rectum, and anus. We have completed advanced surgical training in the treatment of these diseases, as well as a full general surgical training. Board-certified colon and rectal surgeons complete residencies in general surgery and colon and rectal surgery and pass intensive examinations conducted by the American Board of Surgery and the American Board of Colon and Rectal Surgery. We are well versed in the treatment of both benign and malignant diseases of the colon, rectum, and anus, and are able to perform routine screening examinations and surgically treat conditions if indicated.